Welcome to another episode from the VetMed Digest. Today we're going to discuss a significant study published in Veterinary Surgery in 2024 titled Comparison of the Diagnostic Yield of 3 and 5 millimeter Laparoscopic Liver Biopsy Forceps in cats. This research addresses a crucial area in feline medicine, obtaining high-quality liver biopsies for accurate diagnosis of hepatic diseases. Hepatic lipidosis and inflammatory liver diseases are the most common diagnosis of feline livers, accounting for nearly 75% of all such conditions. A liver biopsy is considered the single most informative diagnostic tool for definitive diagnosis of these conditions. Traditionally, larger samples obtained via surgical laparotomy, such as guillotine or wedge biopsies, were the gold standard due to their size, which allows for enhanced diagnostic testing. However, these invasive methods come with drawbacks, including larger abdominal incisions and longer recovery times. Laparoscopy, a minimally invasive procedure, offers a safer alternative for abdominal organ visualization and biopsy collection, while 5 millimeter cut biopsy forceps are the standard for laparoscopic tissue sampling in dogs. There has been a lack of specific data for cats. The authors note that the 5 millimeter forceps, being 36 centimeters long, can be cumbersome in smaller feline patients, yielding relatively large tissue samples compared to the organ size. This led to the interest in newer pediatric laparoscopic equipment, such as miniature 3 millimeter biopsy forceps, which are shorter at 20 centimeters long. A previous study in canine cadavers found no significant difference in morphologic diagnosis between 3 and 5 millimeter laparoscopic biopsy forceps. However, liver biopsy techniques, particularly concerning forceps size and collection methods, has not been thoroughly investigated in feline patients, at least until now. Anecdotal evidence suggests that a twisting motion during laparoscopic liver biopsy might aid hemostasis, and recent research in canine cadavers indicate that a 360 twist technique yielding larger sample size with fewer artifacts compared to a pull technique. Yet comprehensive research on different laparoscopic liver biopsy techniques and their sample quality in both cats and dogs was limited. The primary objective of this study was to determine if a 3 millimeter miniature laparoscopic liver biopsy forceps could provide samples of equivalent diagnostic quality for cats when compared to the standard 5 millimeter forceps. A secondary objective was to compare the effect of 3 different biopsy collection techniques, a twist, a pull, and a twist-pull method on sample size and quality. The researchers hypothesized that 3 millimeter biopsies would be diagnostically equivalent to 5 millimeter ones, and that 3 millimeter forceps and the twist technique might result in more tissue fragmentation and crush artifacts. The study design employed an experimental design using 12 purpose-bred male colony cats. These cats were part of a concurrent nutrition study and were deemed clinically healthy based on multiple physical examinations, serum biochemistry, and complete blood counts. Each cat underwent 2 separate laparoscopic liver biopsy procedures, one in April and one in August of 2021. Unfortunately, one cat developed urinary signs after the first biopsy and was excluded from the second procedure. For the procedures, cats were pre-medicated, induced, and maintained under general anesthesia using standard veterinary protocols. A surgical procedure was performed by a board-certified surgeon and one of 2 surgical residents. A modified Hansen technique was used to introduce a 5 millimeter trocar cannula into the abdomen, followed by insufflation with carbon dioxide and insertion of a 5 millimeter telescope for visualization. A second instrument portal was created for biopsy collection, and a cursory abdominal exploration was performed. Liver biopsies were collected from the edges of the liver lobes, carefully avoiding previous biopsy sites. In the first biopsy event, 2 samples were collected per cat, a paired 3mm and 5mm biopsy using the twist pool technique. In the second biopsy event, 4 samples were obtained per cat, and they were paired 3mm and 5mm biopsies for both the pull technique and the twist technique. The order of forceps size and technique was randomized at the time of collection. In total, each cat had 6 biopsies performed across the 2 events, resulting in 68 samples for analysis. Access to the right liver lobes was somewhat limited in larger cats when using the shorter 3mm forceps. The biopsies were performed using 3 and 5mm Storrs Blakesley cut forceps. For the twist plus pull technique, forceps were twisted 90 degrees clockwise while gently pulling away from the liver lobe. For the twist technique, forceps were twisted 180 degrees back and forth until the sample was released. For the pull technique, forceps were simply pulled away from the liver lobe. Immediately after collection, each sample was measured in square millimeters using a sterile ruler and weighed. Post-operatively, cats received pain medication and were monitored. For microscopic analysis, samples were blinded and examined by a board-certified veterinary pathologist. The pathologist assessed the number of portal triads and hepatic lobules, the presence and severity of crush and fragmentation artifacts using a scoring rubric of 0 to 3, and determine a morphologic diagnosis. The study collected 68 samples from 12 cats. The cats had a median age of 21 to 24.8 months and a median weight of 5.5 kilograms. Regarding biopsy sample weight, 31 sample pairs were weighed. The mean weight for the samples obtained with the 3mm forceps was 0.056 grams, and for the 5mm forceps it was 0.079 grams. The 5mm biopsy forceps consistently resulted in heavier samples than the 3mm forceps, with statistical significance less than 0.01. Interestingly, there was no significant difference in sample weight based on the biopsy technique. For tissue surface area, the 5mm biopsy forceps also resulted in significantly larger tissue surface area in square millimeters compared to the 3mm forceps, with a p-value less than 0.0001. When looking at hepatic lobules and portal triads, the key indicators of tissue quality, the results were clear. The 3mm forceps yielded a mean of 4.9 hepatic lobules, while the 5mm forceps yielded a mean of 12.4. Similarly, for portal triads, the 3mm forceps provided a mean of 19 compared to the 29.6 for the 5mm forceps. The 5mm forceps provided significantly more hepatic lobules and portal triads than the 3mm forceps, and that p-value is less than 0.0001. Regarding technique, the twist technique resulted in more hepatic lobules than the twist pull technique, and that p-value is 0.005. Furthermore, both the pull and twist techniques resulted in more portal triads than the twist pull technique, with a p-value of 0.003 and a p-value of 0.015 respectively. In terms of histologic area, the 5mm biopsy forceps provided a larger histologic area in square millimeters than the 3mm biopsy forceps, with a p-value less than 0.0001. The biopsy technique, however, did not have a significant overall effect on the histologic area, with a p-value of 0.06. Analyzing crush and fragmentation artifacts, the study found no significant effect of forceps size on tissue crush. However, there was a significant effect of biopsy technique, with the twist pull technique resulting in greater tissue crush than the twist technique, and that p-value is 0.01. Despite this, all tissue crush grades were categorized as moderate or less and did not prevent a histopathologic diagnosis. No significant difference was observed in fragmentation artifact for either forceps size or technique. Finally, for histopathologic diagnosis, the study found good agreement between the 3 and 5 millimeter biopsy samples when the twist pull technique was used. However, there was poor agreement between the 3 and 5 millimeter samples for both the pull and the twist technique. Importantly, all samples analyzed, regardless of the size or technique, were deemed of sufficient diagnostic quality and received a final histopathologic diagnosis. The diagnoses were distributed equally across forceps size and were generally mild, including reactive portal hepatitis and periportal lipidosis. The majority, 54 out of 68 samples, were diagnosed as normal liver. This study represents the first of its kind to assess the use of miniature laparoscopic biopsy forceps for liver biopsies in cats. The results indicate that while a 3 millimeter miniature laparoscopic biopsy forceps provides smaller samples than the 5 millimeter forceps, these samples still contain sufficient hepatic lobules and portal triads to allow for histopathologic diagnosis. Specifically, the mean number of portal triads obtained with the 3 millimeter forceps was 19. This is notably greater than the 6 to 11 portal triads typically needed or recommended for accurate grading and staging of liver disease in humans, and is also higher than the 13.8 reported for 3 millimeter forceps in dogs. This suggests that 3 millimeter miniature cut biopsy forceps theoretically provide enough tissue for a microscopic diagnosis, grading, and staging of liver disease. The study also highlighted that both the twist and pull techniques yielded more portal triads per sample compared to the twist pull technique, potentially indicating larger samples with more hepatic architecture. Interestingly, the mean surface area of liver biopsies using the 3 millimeter miniature biopsy forceps in this study was approximately 20 square millimeters, which is comparable to the 25 square millimeters reported for wedge liver biopsies in cats. This suggests that using more invasive surgical techniques solely for obtaining a larger sample might not always be necessary, and the 3 millimeter forceps can provide a similar sample area. Regarding artifacts, while the twist-pull technique did lead to greater tissue crush artifact than the twist technique alone, the median crush artifact was mild, classified as grade 1. Crucially, this did not impede the ability to obtain a morphological diagnosis from any of the samples, suggesting it may not even be clinically relevant. When comparing the forceps size, there was no overall difference in crush and fragmentation grades between the 3 and the 5 millimeter biopsy forceps. Both instruments demonstrated an excellent ability to limit liver tissue sample damage, making them reliable for clinical use. A notable finding was the good agreement in morphologic diagnosis between 3 and 5 millimeter samples when the twist pull technique was used, contrasting the poor agreement seen for the pull and twist techniques. The authors suggest that this discrepancy might be due to several factors. In this study, single comparisons were made between paired 3 and 5 millimeter samples. In clinical practice, however, multiple samples are typically collected from different liver lobes and assessed collectively to achieve an overall diagnosis, which might yield higher agreement. The study also lacked a definitive diagnosis from a gold standard method, like the guillotine biopsy or post-mortem examination. Furthermore, all twist-pull samples were obtained during the first biopsy event involving all 12 cats, while the pull and the twist samples were from a second event with only 11 cats, potentially influencing the observed agreement. The study acknowledges several limitations. The collection of only one sample per technique with the forceps size at different time points may have limited the morphologic diagnosis agreement data. The involvement of 3 veterinary surgeons with varying surgical experience could also have introduced variability in sample size quality. Most importantly, the use of clinically healthy colony cats rather than cats with actual liver disease limits the generalizability of conclusions to a clinical population. Future prospective studies in cats with clinical liver diseases are warranted. The study also highlighted the practical challenge. The 3 mm forceps shorter shaft length could restrict access to all liver lobes in larger cats, suggesting that the instrument portal might need to be placed more cranially in such cases. In conclusion, this research demonstrates that liver samples can be safely collected in cats using either 3 or 5 mm laparoscopic biopsy forceps, providing sufficient tissue for histopathology analysis with minimal artifact. However, due to limitations such as lack of randomization of biopsy techniques between surgeons and biopsy events, and the comparison of only one sample pair per technique, the diagnostic accuracy of 3 mm samples remains unknown. Further research investigating biopsy techniques and forceps size in clinical feline patients with samples collected at the same time points and under consistent conditions is recommended to confirm these findings. That is it for this article. Thank you for listening to the VetMed Digest. Remember, there's questions below to test your knowledge, and a link for the article is in the description. And as always, keep your minds inspired, hearts light, and tails wagging.